Well, good afternoon. I'm David Shepherd, MLA for Edmonton-City Centre, here today with my colleague, Dr. Luanne Metz, our critic for health. We saw today the announcement of progress towards a funding framework for family physicians in the province of Alberta. And both Dr. Metz and I truly hope that we have seen some true progress and that there is help coming for family physicians. We know that under this government, over the last 5 years, family medicine in the province of Alberta has been devastated. This government forced through deep cuts in the midst of a pandemic, saved hundreds of millions of dollars on the backs of family physicians in this province, largely by nickel and diming them on virtual care in the midst of a pandemic. Outright war with physicians, which led to where we are today, where we have hundreds of thousands of Albertans who do not have access to a family doctor, where a large majority of family doctors have said they are not sure they can afford to keep the doors of their clinics open through the end of this year. So it is desperately important that we see real action from this government in supporting these doctors. Now, of course, we saw the announcement of a framework, but no details today. The devil is in those details as to what's actually going to be there for these doctors. So we are concerned that what was announced today does not actually provide a single dollar to actually help keep clinic doors open today at a time when we know about 35%, I'm told, of doctors currently operating do not qualify for the transitional funding that the government has put forward due to their panel size, despite the Alberta Medical Association having advocated for them to be covered and for them to be supported. So we're going to be watching for much more, I think, in terms of details on this package. But certainly we know that we do not have a record of this government acting in a way that physicians can trust. So it is certainly our hope that we are seeing a pivot and a change, but much more remains to be seen to be able to assess what we have here. We're happy to take any questions.
All right, thank you, David. We'll go to questions in the room first. Just please state your name and outlet.
Sure, yeah, it's Shailan Skolsky with CTV News in Edmonton. I'm just wondering, in terms of some of the comments from the minister, she said initially that she is committed to ensuring that family physicians are the highest paid in Canada, and then minutes later said that she's keen to be a leader, but not necessarily committing to that. I guess, what do you make of that, those two different comments, and do you think that the minister should commit to that in terms of making Alberta physicians the highest paid in the country when we do see other provinces that are looking to attract those professionals?
Well, I think what we've seen under the UCP is that Alberta has fallen to the back of the pack in terms of being an attractive jurisdiction for doctors in the province of Alberta. And it was a frequent refrain, from Minister Shandro, Minister Copping, and indeed we've heard it from Minister LaGrange about Alberta doctors being the best paid in Canada. Certainly we need to have competitive compensation if we want to retain the doctors we have, if we want to attract new doctors, and if we want to keep the graduates that we have here in the province. So I think it's essential that we see an update to that work. Do you have anything you wanted to add?
Yeah, I think that we need this done fast. That's the other thing, is that we know that there were fully prepared, costed proposals put forward in Q1 of 2023 to the ministry, and they're still talking and planning. If they can't agree on things, why is that? Because really they're announcing today that something that, yeah, we know they're working on this, but they haven't told us anything about any step of real progress. And now we're finding out that they're not even expecting a rollout until the fall. Well, we know that there's a lot of practices that are going to close in that time, and they have no information other than, trust me, we're going to get something done. We do need to be competitive, and we need a promise that we're going to be competitive, and we need the details of how.
Yeah, just I guess aside from a speedy delivery on this, what specifically do you think is needed to attract and recruit and ensure that those professionals stay here in Alberta?
We need to assure that the physicians need to be assured that they're going to be compensated for that teamwork and that work that they do that is not face-to-face with a physician. And in part, that's reviewing lab results, making referrals, filling out paperwork, all of that extra work that is done and is not compensated but is actually increasing and also that the teams that they can work with are going to be built. How are we going to do that? We need to build those teams.
I would also say I think what family doctors really do want to see is that they have a government who is investing in providing stability in the broader healthcare system as a whole. Because family medicine isn't isolated. It is one of the most important parts of the system, in what area we desperately need to build up to take pressure off of acute care, emergency care, and a lot of other areas. But, when they look and they see that, we apparently can't even look after our most fragile newborns properly, because the government is not investing in the capacity that's needed, because we are short on critical staff across the system, that ripples down the entire chain. And in particular, when we have the uncertainty of this government's reorganization of the entirety of the healthcare system in a way where they're looking to assume more direct control, I think that has an impact on family physicians as well.
Hi, Janet from the CBC. Just looking for a bit more detail from Luanne about, sorry, did you say 2021 there had already been a fully costed proposal?
No,
just wondering what you're referring to.
2023, so over a year ago. And this was by different groups. They invited proposals, and there are models in this province that have been shown to work well and elsewhere. And we're just not moving on this. This could have been there and operating.
I just want to hop back to the NICU issue. So we did try to ask the minister some questions about it this morning. We're still not getting much of a sense of how long she's known about the problem or how bad the problem is. I'm wondering how much you think she's now downplaying the issue today from what we heard yesterday about talk of moving children out of the province.
If the minister was not aware, that suggests either the minister is not paying attention to her briefing or her staff did not brief her. In either case, that's deeply disturbing given the level of chaos and crisis we know continues to exist in our healthcare system, that the minister would not have her eye on the ball on something so crucial. I do know that, throughout over the last couple of years, at multiple points, various people in different areas of acute care and emergency care, and certainly critical care, have reached out to consecutive ministers. I remember bringing this up with Minister Copping at estimates in 2022, that people in acute care were raising concerns about that lack of support, about the potential this impact could have, that people could in fact lose lives due to a lack of the resources needed, that being both rooms and beds and that being critical staffing shortages. So I think the Edmonton Zone Medical Staff Association has been clear. They sent briefings to the minister's office twice in 2022 and 2023. This government instead is focused on tearing down and reorganizing the entirety of the system. They're playing all sorts of pet political games, the Premier's personal obsessions. But it doesn't seem they have much appetite for the actual work of governing and paying attention to some of the crucial pieces they should be looking after on behalf of Albertans.
All right, we'll go to questions on the phones. Just a reminder, if you're joining us on Zoom, to use raise hand. And if you're joining us on the phones, to use the *9 function to get into the question queue. And with no questions on the line, we'll do one last pass for questions in person. And with no further questions, we'll wrap today. Thanks, folks.
Thank you.